International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello, my name is Tama. I'm a health economist working at the Strathmore University. I previously worked at the KEMRI Wellcome Trust Research Program, where we set out to carry out an evaluation of the implementation of the free maternity services policy. This policy was introduced in 2013 in an effort to increase the number of mothers giving birth in health facilities. The policy was meant to address the problem of lack of financial access to maternity services and was also a fulfillment of a pre-election pledge by the ruling government in the run-up to the 2013 general elections. We therefore conducted a process evaluation of the policy to understand how the policy was implemented and to explore the reasons why we observed the outcomes that we observed. This study was conducted in 3 Kenyan counties of Kilifi, Khayatzadeh, and Kakamega. A review of documents revealed that the policy did not have a formal policy document, except for a few circulars that were issued by the national government to the county governments. The benefit package was also not clear. At the health facility level, stakeholders were not clear whether the policy just covered deliveries or it included antenatal and postnatal care as well. Health facilities were required to send monthly utilization reports to the Ministry of Health and funds reimbursed quarterly on a case-based mechanism. We found out that the policy was largely received positively by stakeholders because they perceived it to address a critical health problem, and also they acknowledged that cost was an important factor that was keeping mothers away from health facilities. The policy led to an increase in the number of deliveries at health facilities. For example, in the year following the introduction of the policy, total deliveries increased by 83% in the first county, 96% in the second, and 74% in the third county. We also found that the free maternity reimbursements were an important source of revenue for health facilities. With the onset of the devolved system of government in Kenya, hospitals lost their financial autonomy, and therefore these funds were the only source of revenue that they had direct access to. However, there were a number of weaknesses in the implementation process. The policy was implemented in a hurry due to political pressure to have it rolled out. As a result, implementation was initiated without official guidelines, which resulted in the policy being understood and interpreted differently by stakeholders, leading to intermittent implementation. Reimbursements were inconsistent and unpredictable, a fact that put a financial strain on health facilities and made it difficult for them to budget and plan for the funds. There was inadequate supply-side capacity that to match the increased demand for services that led to an increase in workload for staff, leading to burnouts and low motivation levels. Physical infrastructure was also stretched, leading to congestion in the maternity wards. And this increased utilization in an environment of limited capacity compromised the quality of care. We also found that there was no system of verifying the utilization reports from health facilities, which increased the risk of facilities gaming the system to get more money by over-reporting utilization. We therefore make a few recommendations to the Ministry of Health. The first one is that the Ministry develops a formal policy document and an implementation plan that clearly articulates the implementation arrangements. Secondly, the Ministry of Health should engage key stakeholders in the implementation of the free maternity services policy, especially the county health departments and healthcare providers, and effectively communicate the policy to ensure there is clarity on policy content and implementation arrangements. Third, the Ministry of Health should ensure that the funds disbursed to providers are timely and predictable, and the county government should review their public finance bylaws and introduce legal provisions that will give providers financial autonomy over the funds that are disbursed to them. Fourth, the ministry and the county government should conduct an assessment of the supply side gaps and make investments in building the capacity of health facilities. We finally recommend that the Ministry of Health and the county governments of health strengthen accountability mechanisms to minimize fraud and subsequent resource wastage. Thank you.